My name is Greg Duncan. I've been a practicing orthopedic surgeon in Crescent City for 24 years. I'm the current chief of surgery at Sutter Coast Hospital and former chief of staff and member of the board of directors of Sutter Coast Hospital. It was during the time I was on the board of directors that I began to learn of the plans to downsize the hospital, raise prices on seniors, reduce the bed capacity by 50%, and limit the patient's length of stay. And Helen's correct in the sense that purported losses were the justification for that drastic action. What I know from being on the board of directors is they failed to submit approximately $7 million worth of bills, additional unbilled services totaling more than $1 million a year just for home health, surfaced later, under what was described by another board member as gross mismanagement. So on paper, the papers that the hospital would give us, they showed losses, and there's much more to the story. There's also much more to the expansion story. For example, this year, without notifying the community, because the hospital meets in a closed boardroom, 12 acute care beds were shut down from the main portion of the hospital. Those are acute care beds that any patient who comes through the ER or for elective surgery or an elective admission could use. Those are no longer available. So we have to be careful when we say that the beds have been expanded. Yes, the unit that is now being used for rehab was reopened, but in place of that, 12 beds in the main hospital were shut down. But I'm not here to really argue about the direction of the hospital. The reason I'm running is to bring better health care and to stop the decline in health care that our region has seen over the past 20 years. Dr. Caldwell and I have been working on this issue almost every day for 5 years. He's the current chair of the Delaware Healthcare District. He and I are colleagues, and he has the biggest heart of anyone that I've ever known in this community. He will not turn away any need. The challenges we face include fewer services. From when I came here more than 20 years ago, we don't have ENT, urology, pulmonology, hospital-based dental care, allergy, all of those services we used to have or we don't have. We need to get those back, and we need to become a medical destination. That's my vision. Everyone in this room agrees that we need good health care in our remote area with a lot of seniors, a lot of disabled people, people that cannot afford to be shipped out away from their family and come back on their own. Additional services I'd love to see would be vascular surgery, neurology, rheumatology, and more internal medicine. The number of emergency transfers more than doubled out of Sutter Coast Hospital between 2006 and 2014. We have higher charges for care. That's another issue I'm working on. This came up at the Board of Supervisor meeting earlier this month, and one of the supervisors actually pointed out that he was subject to the out-of-network ER doctor charge. And that's where you go to the ER, you see the physician there not realizing, if you're on a private insurance plan, that he's not in your network. You can charge anything he wants. And I've seen the bills. It's around $1,300 just for the doctor charge. I'm not even talking about Sutter's charge. And because they're out of network, you don't have the reduction in allowable fee that your insurance company will bring you, and you're responsible for a much higher out-of-pocket cost. That has to stop. At least put a sign in the waiting room that says you're going to be charged $1,300 by a doctor who's not in your network. I just think that's wrong. I'd love to see that change as a first priority if I do get elected. But yeah, we do need to collaborate with Sutter. They're here. I collaborate with them every week. I met with Sutter administration this week, and we're working together to make a better hospital, a better department of surgery, and to add services. We absolutely have to collaborate. But if we find ourselves in a situation where that's not their corporate plan from Sacramento, then I'm going to say something about it after trying to resolve it internally, which I did when I was on the board of directors. But we also, I think we need another healthcare system, more options for patients. And I'm in talks now with other healthcare systems, and I hope that I can announce something, or the healthcare district can announce something, that we're going to be adding not just more services, but hopefully another healthcare system. The goal basically for me is to maintain a full service acute care hospital and to add the services that we need and used to have and more. see fit to send me to the Healthcare District Board, that's what I'll work to do. And I thank you very much for your time.